This video is intended to help you as you begin treatment with Remodulin. Your healthcare provider will provide you with specific instructions on how to prepare your Remodulin for use, which may be different from the steps you see in this video. The specific supplies prescribed by your healthcare provider may also be different from the supplies you see in this video. You should always follow the specific instructions and use the supplies recommended by your healthcare provider. Please consult your healthcare provider if you have any questions as you begin treatment with Remodulin. When taken intravenously, Remodulin must be diluted before injection with a special solution called a diluent. Your healthcare provider will prescribe one of the following diluents for this purpose: sterile water for injection, 0.9% sodium chloride for injection, or Flolan sterile diluent for injection. You should always use the diluent prescribed by your healthcare provider when preparing Remodulin for injection. Please consult your healthcare provider if you have any questions as you start Remodulin treatment. There are two ways to administer Remodulin: intravenously and subcutaneously. Intravenous infusion uses a surgically placed catheter and pump to continuously administer Remodulin directly into a vein in the upper chest, to keep the right amount of medication flowing into your body 24 hours a day, 7 days a week. With intravenous Remodulin, there are several pump options. You and your doctor can decide which pump is best for your lifestyle. In this segment, we'll focus on administering intravenous Remodulin via the CADD MS-3 pump. The process involves 7 steps. While the steps aren't particularly difficult, it's important to follow them in the order given. The steps are gathering the necessary supplies, mixing the medication, loading the cartridge, priming the tubing, connecting to your IV access device, and starting the infusion. We'll cover each of these steps in turn. We'll also cover how to prepare your alternate pump for storage. Before you gather your supplies, it's important to wash your hands thoroughly using antibacterial soap and water. Once your hands are washed and dried with a paper towel, gather the following items: your CADD MS-3 pump, a full unopened vial of Remodulin, a vial of your prescribed sterile diluent, 2 vial adapters, 1 3 milliliter cartridge syringe with a dead-end white cap and needle, 1 3 milliliter syringe, 2 20-gauge needles, your extension tubing, several alcohol swabs, a split septum device, a AAA battery, a sharps container, and your dosing sheet. Once you have all your supplies, clean your work area thoroughly using isopropyl alcohol and a swab. Open the supplies and place them on the work surface you just cleaned. Discard all packaging and thoroughly wash your hands again. Next, take the vial of Remodulin and remove the plastic cap. Do the same with the vial of sterile diluent. Open an alcohol swab and use it to clean the rubber stopper on the tops of both vials. Take one of the vial adapters and push its spike into the rubber stopper of the Remodulin vial. Repeat the process with the other vial adapter and the vial of sterile diluent. Using an alcohol swab, clean the rubber stoppers on both vial adapters. You are now ready to mix your Remodulin. Mixing your Remodulin correctly and accurately is extremely important to protect your health and safety. You should always begin the process by checking your dosing sheet and verifying the amounts of Remodulin and sterile diluent you will be placing in the 3 milliliter cartridge. Once you've verified the correct amounts, take the 3 milliliter cartridge syringe. Pull the plunger back and forth 3 times to lubricate the syringe. Next, place the plunger on the mark that corresponds exactly to the amount of prescribed diluent on your dosing sheet. Attach the syringe to the vial of sterile diluent and push the plunger completely, so that all the air in the syringe enters the vial. Invert the vial and pull the plunger back as far as it will go, drawing in the sterile diluent. Tap the sides of the syringe to remove all air bubbles. Position the plunger on the mark corresponding with the exact amount of prescribed diluent. Remove the syringe. Finally, attach one of the 20-gauge needles to the syringe. Place the connected unit aside on your clean work surface. Next, take the 3 milliliter syringe and pull the plunger back to the mark that corresponds exactly to the amount of prescribed Remodulin on your dosing sheet. Attach the syringe to the vial of Remodulin and push the plunger completely so that all the air in the syringe enters the vial. Invert the vial and pull the plunger, drawing in the prescribed amount of Remodulin. Tap the sides of the syringe to remove all air bubbles, and check to make sure that the correct amount of Remodulin is in the syringe. Remove the syringe. Attach the other 20-gauge needle to the syringe. Place the connected unit aside on your clean work surface. Now take the syringe with the diluent that you filled earlier and remove the needle. Pull the plunger back to the 3 milliliter mark. Next, remove the needle cap from the 3 milliliter syringe containing the Remodulin. Place the tip of the needle into the cartridge syringe. Inject the Remodulin. Discard the Remodulin syringe in the sharps container. Next, you'll need to mix the Remodulin and diluent. Gently rotate the cartridge syringe, then hold it upright and push any air out of the cartridge. When the cartridge is emptied of air, attach the white cap to the end of the cartridge. To remove the plunger from the cartridge, gently rotate the plunger counterclockwise. Place the cartridge on your clean work surface in preparation for loading it. To load the CADD MS3 cartridge, begin by removing the battery cap and the cartridge cap. Using an alcohol swab, wipe the interior of the cartridge cap and place the cap aside. Take the AAA battery and place it into the battery chamber. Replace the battery cap. The cap must be coin-tight. Once the battery has been replaced, the pump will run a self-test. The display will read, "Cartridge removed. Press OK to begin load process." When the message is displayed, press the right program button 3 times. The push rod will retract. Once the push rod is retracted, the display should read "No cartridge detected," and the word "Confirm" should appear in the lower right corner of the screen. Next, place the cartridge in the cartridge chamber and press the right program button. The readout will display the message "Sensor confirmed. Remove cartridge and press OK." Remove the cartridge, press the right program button, and wait until the push rod has moved forward. When the push rod stops moving, the display will read "Install filled cartridge, then press load." Place the cartridge in the chamber and turn it clockwise slightly. Then press the right program button. The cartridge is now loaded securely into the chamber. The cartridge menu will appear in the display. The Fill Tubing choice will be highlighted. Attach the cartridge cap and remove the white cap on the pump. Attach the extension tubing to the area of the cartridge you just removed the white cap from. If your HCP requests use of a split septum device, you will be given specific instruction on priming of this device. You should attach the device to the end of the extension tubing once a week. Once the extension tubing is attached, it's time to prime the tubing. The Fill Tubing choice should still be highlighted on the screen. Press the right program button, and the display changes to show just the highlighted choice and the word Start in the lower right corner of the screen. Press the right program button, and the pump will prime with 0.3 milliliters of fluid. The pump reads Fill Tubing and Start appears in the lower right corner of the screen. Press the right Program button. The screen will then display the message, Continue to fill tubing. The option labeled No is highlighted. Using the scroll button, highlight the Yes option. Then press the right Program button. The pump will continue to prime the tubing. When the tubing is primed, the word Stop appears in the lower right corner of the screen. A drop of fluid will also appear at the end of the extension tubing. When you see both of these indications that the priming is complete, press the right Program button. The screen will now display the word Back in the lower left corner. Press the left Program button, and the cartridge menu will appear. The word Done also appears in the lower left corner of the screen. The next step is to program your pump. After you've primed your tubing, and the cartridge menu and the word Done are displayed on the pump screen, press the left Program button. The main menu will appear. Use the down scroll button to highlight the choice labeled Delivery Program. Press the right Program button. The screen displays the phrase Choose Delivery Methods. The option Continuous Rate Yes is highlighted. Press the right Program button. The time should be 12 o'clock a.m. The current rate will also be highlighted. The word OK will be displayed on the lower left of the screen. Consult your dosing sheet if necessary. If the rate displayed is correct, then press the left Program button. If the rate is incorrect, you'll need to change it. Begin by pressing the right Program button to highlight the word Edit. Then use the up or down scroll buttons until the correct rate is displayed. When the rate is correct, press the left Program button twice, and the main menu will be displayed. You are now ready to connect the pump to your central line. Prior to handling your central line, be sure you wash your hands again. To connect the CADD MS3 pump to your central line, begin by clamping the central line. Using an alcohol swab, clean the end of the central line. Then take the new extension tubing from your work area and remove the end cap. Connect the new extension tubing to your central line and unclamp the line. The next and final step in the process will be to start your infusion. After connecting to your central line, the main menu should still be displayed in the pump's readout, and the choice labeled Start Delivery should be highlighted. To start the infusion, begin by pressing the right Program button. The readout will display the phrase Review Program. Press the right Program button again, and you will be asked to confirm the delivery method. The choice Continuous Rate will be highlighted. Press the right Program button to confirm a continuous infusion. Next, you'll be asked to confirm the rate of that infusion. The readout will display the phrase View Continuous Rate. To confirm that the rate is the same one you entered earlier, press the right Program button. The pump will default to the choice Current Time and Running. This means that the pump is now running and that the rate of infusion is being administered and tracked from this moment on. The only remaining steps are to place the pump in its holder, discard any leftover wrappers or other trash, and put your remaining supplies back in storage, including your alternate pump. After removing your pump, there are several steps you should follow to store it and keep it in working order. First, once the pump has been removed, press the right Program button twice. The option to Stop Delivery will be highlighted. Press the right Program button. When the screen displays the message Stop All Delivery, press the right Program button again. The message will change to Pump Stopped. When you see the message, you can now remove the battery cap and take out the battery. Then replace the battery cap. Next, remove the cartridge cap. Discard the cartridge and tubing. Replace the cartridge cap. Your pump can now be stored. Remember, as you begin treatment with Remodulin, you should always follow the specific instructions and use the supplies prescribed by your healthcare provider. Please consult your healthcare provider if you have any questions as you start Remodulin treatment. Remodulin treprostinil injection indication. Remodulin is a prostacyclin vasodilator indicated for the treatment of pulmonary arterial hypertension, PAH, WHO Group 1, to diminish symptoms associated with exercise. Studies establishing effectiveness included patients with NYHA functional class 2 to 4 symptoms and etiologies of idiopathic or heritable PAH, 58%, PAH associated with congenital systemic to pulmonary shunts, 23%, or PAH associated with connective tissue diseases, 19%. It may be administered as a continuous subcutaneous infusion or continuous intravenous infusion. However, because of the risks associated with chronic indwelling central venous catheters, including serious bloodstream infections, continuous intravenous infusion should be reserved for patients who are intolerant of the subcutaneous route or in whom these risks are considered warranted. In patients with PAH requiring transition from Flolan, epiprostenol sodium, Remodulin is indicated to diminish the rate of clinical deterioration. The risks and benefits of each drug should be carefully considered prior to transition. Important safety information. Chronic intravenous infusions of Remodulin are delivered using an indwelling central venous catheter. This route is associated with the risk of bloodstream infections, BSI, and sepsis, which may be fatal. Therefore, continuous subcutaneous infusion is the preferred mode of administration. Remodulin should be used only by clinicians experienced in the diagnosis and treatment of PAH. Remodulin is a potent pulmonary and systemic vasodilator. It lowers blood pressure, which may be further lowered by other drugs that also reduce blood pressure. Remodulin inhibits platelet aggregation and therefore may increase the risk of bleeding, particularly in patients on anticoagulants. Remodulin dosage adjustment may be necessary if inhibitors or inducers of CYP2C8 are added or withdrawn. Initiation of Remodulin must be performed in a setting with adequate personnel and equipment for physiological monitoring and emergency care. Therapy with Remodulin may be used for prolonged periods, and the patient's ability to administer Remodulin and care for an infusion system should be carefully considered. Remodulin dosage should be increased for lack of improvement in or worsening of symptoms, and it should be decreased for excessive pharmacologic effects or for unacceptable infusion site symptoms. Abrupt withdrawal or sudden large reductions in dosage of Remodulin may result in worsening of PAH symptoms and should be avoided. Caution should be used in patients with hepatic or renal insufficiency. The most common side effects of Remodulin included those related to the method of infusion. For subcutaneous infusion, infusion site pain and infusion site reaction, redness and swelling, occurred in the majority of patients. These symptoms were often severe and could lead to treatment with narcotics or discontinuation of Remodulin. For intravenous infusion, line infections, sepsis, arm swelling, tingling sensations, bruising, and pain were most common. General side effects, greater than 5% more than placebo, were diarrhea, jaw pain, vasodilation, and edema. For full prescribing information, visit www.remodulin.com or call 1-877-864-8437.